Welcome from the University of Michigan in Flint. As we all know, Flint has been a popular subject on the news the past year. The Flint water crisis has made national news, has become the poster child for water reform. In 2016, the Water Infrastructure Improvements for the Nation Act, also known as the WIN Act, was passed. The main aspect of this act is the Water Resources Development Act. The mission of this act is to improve America's water resources infrastructure. All Americans should have access to clean water. It shouldn't be just a privilege, but a right. Fresh, clean water is essential for a healthy society. Another act that has greatly impacted the health of our society has been the Patient Protection and Affordable Care Act, also known as the Affordable Care Act or Obamacare. This extremely controversial act was set in motion to provide affordable and adequate health coverage for all Americans. We'll be discussing the details of the Affordable Care Act and digging a little deeper about some of the aspects and structures of it.
Hi, I'm Marcus Basson. A few years ago, residents in the city of Flint began to make several complaints of health issues that they were experiencing from using their household water. City officials had recently switched the source of the municipality's water supply, leading to reusage of old and unfortunately neglected lead-based water infrastructure. Residents' concerns were largely ignored by state-level officials until professional advocates working to get to the bottom of the issue discovered that children within Flint, the city of Flint, had experienced elevated blood lead levels that children residing in surrounding areas and cities were not experiencing. One advocate group, the Virginia Tech Water Study Team, which was led by Dr. Mark Edwards, along with Dr. Mona Henna-Atisha, a local pediatrician in Flint, contributed to efforts in officially legitimizing this water crisis as a real public health issue in need of resources that were beyond the scope of the city. The damaging effects of lead exposure are well documented. The risk posed to children are far greater, threatening irreversible neurological injury if not treated early and often, as children are at a risk of absorbing large amounts of lead whenever they are exposed. The particular crisis of lead-contaminated water in Flint, Michigan, was officially recognized by the city of Flint on December 14, 2015, when a state of emergency was declared. Now, this was about 3 months after the Virginia Tech study provided their results, as well as also about 3 months after Dr. Mona Henna-Atisha, as well as her colleagues, published and completed their study to discover the elevated blood lead levels in the children within the city of Flint. The city's recognition came prior to also a state of emergency declared by the governor of Michigan, Rick Snyder, which was almost an entire month after the emergency declared by the city. In addition, the governor's declaration came even further after the admissions of the Virginia Tech study team, as well as Dr. Mona Henna-Atisha, leaving children further at risk of absorbing lead exposure and being contaminated, without any official reasoning to provide resources to the city in addressing the situation. After Virginia Tech professor and expert on water municipality Mark Edwards completed their study, then it was reported that the water being used was corrosive and causing leads and leach into the drinking water by state officials as well. The water crisis did not become salient until it was officially recognized by these professionals, and their work not only helped to legitimize the issue, but it also helped to bring greater awareness on a national scale, where we begin to see actors, musicians, celebrities, and other famous people begin to utilize their platforms, their influence, their resources to bring in donations and to also bring in greater awareness about the issue at hand. Former President Barack Obama visited the city of Flint after receiving a letter from one of the children that was affected by the crisis. The purpose of his visit was to support the citizens by utilizing his role as commander-in-chief to put the water crisis in Flint on the national public agenda. As stated before, the effects of lead contamination are well known. There have already been laws put in place in order to address the situation of lead-based products, lead-based gasoline, lead-based water infrastructure, and unfortunately in the city of Flint, these issues. Now that we have an introduction to the problem, we won't just only discuss the public health ramifications regarding this, but how does the Affordable Health Care Act relate in assisting in providing a solution to this water crisis issue here that the city is experiencing? Thank you.
Hi, my name is UM-Flint. The Patient Protection and Affordable Care Act, better known as Health Insurance Reform, Health Care Reform, Obamacare. The Affordable Care Act, ACA, became law with former President Obama's signature that represent the most significant transformation of the American health care system since Medicaid and Medicare. It has been contended that ACA establishes universal coverage for health care as a national goal and defines the responsibilities of individuals, employers, and the government in contributing to its costs. Many Republicans and 3 Democrats voted to repeal the Affordable Care Act on January 19, 2011. Since, Republicans have vowed to try again and again to repeal the Affordable Care Act. In the early days of the Affordable Care Act, individuals' mandate was challenged, not just by the court of the public opinion, but by the highest court in the land, the Supreme Court. In 2010 and 2011, different federal circuit courts, the 6th and the 11th, issued conflicting decisions regarding the constitutionality of requiring every American citizen to obtain health insurance. The Supreme Court took the issue up for review on November 14, 2011. As of 2017, President Donald Trump and Republican leaders of Congress seeks to repeal and replace the Affordable Care Act by using a strategy to repeal 2 key elements of the health reform law: the insurance premium tax credits and the expansion of Medicaid eligibility. One of the most essential elements of ACA is giving a mandate for individuals and requiring businesses as a matter of law that every American have an approved level of health insurance or pay a penalty. Many Americans were living without health care coverage. This change became a major issue with the health insurance industry and regulations on the practices of medicine. Congressional Republicans were seeking to block sections of the law or cut off funding for key provisions. At the time of political debate, House Republicans in February approved 9 amendments that would block health reform funding as part of a spending bill of the remainder of the fiscal year of 2011. Numerous attempts have been made by Congress to repeal the Patient Protection and Affordable Care Act since its enactment. For example, a repeal bill passed both houses on Congress, but it was vetoed by the former President Obama because there was no general defined agreement among congressional Republicans on what should replace ACA. To some extent, a professor and a co-director of Georgetown University Law Center, Lawrence Gostin, affirms that there were several important factors for developing sound public policies. Congressional voting is influenced by many factors. Congress is made up of both standing committee and select committees. Typically, standing committees have the power to generate legislation in their particular areas of jurisdiction, such as tax writing or appropriation. Select committees, such as Senate Special Committees on Aging, are primarily advisory in nature. In support, Senate.gov states, the 2 houses may have begun to resolve their legislative differences by way of a conference, committee, or through an exchange of amendments between the houses. Congress' mandate is to protect the health of public. It has the power to engage in a lengthy deliberation process in enacting legislation. Lawmakers increasingly rely on the committee system to sift through the facts and determine how issues should be resolved. This implies policymakers must have a well-considered criteria for making the decision. This is done by examining the public health interests, examining the overall effectiveness of the policy, evaluating whether the policy is well targeted, identifying the human rights of burdens, and examining whether the policy is the least restrictive alternative. The jurisdiction of the Subcommittee on Health shall include bills and matters referred to the Committee of Ways and Means that relate to programs providing payments for health care, health delivery service, or health research according to the Ways and Means Committee website. When utilizing SECT 2203, Registry for Lead Exposure and Advisory Committee of the WIN Act, the Secretary shall establish within the agency for Toxic Substances and Diseases Registry, or the Center for Diseases Control and Prevention at the discretion of the Secretary. After a person has been properly registered as it relates to emergencies such as lead in water or in Flint water crisis, effective services will be identified, including services related to health care, education, and nutrition for individuals and communities affected by lead exposure and lead poisoning. Then, ACA, Affordable Care Act, will support the health care expenses. More intentionally, as supported by the Committee of Ways and Means, the jurisdiction of the Subcommittee on Health shall include bills and matters that's related to healthcare programs of the Social Security Act.
Hi, I'm Danielle. We're going to talk about interest groups, coalitions, PACs, and the regulation agency that's involved in the water infrastructure. So the first interest group we're talking about is the AMA. This group, in light of the Flint water crisis, adopted a new policy, and this new policy supports state and federal laws to remove lead service, piping, and lime materials that come into contact with contaminated water. This new policy advocates that all schools and daycare sites should receive by law water quality assurance testing. Currently, laws do not apply to all schools and daycares, and according to the EPA, 90,000 public schools and 500,000 child care facilities are not regulated, and they may or may not be conducting the testing that's needed. The National Association for Water Companies is another interest group, and this interest group is a collaboration of a lot of different water companies, private industry water companies. They work within the parameters of the Safe Drinking Water Act and the Clean Water Act that's enforced by the EPA. The National Association for Water Companies looks for new solutions that are related to the challenges of the aging water infrastructure in the nation. And this includes the limited water supply, budget deficits for technology, and facilities to ensure the quality water and wastewater services. The coalition we'll be talking about is the U.S. Water Alliance. And this is a nonprofit organization that is made up of many companies that represent utilities, public officials, business community, environmental organizations, community leaders, policy organizers, and researchers. This coalition started in 2015, and they work to promote the Value of Water campaign. The Value of Water campaign is supported by top leaders in the water industry, including the National Association for Water Companies. They're committed to raising awareness of the importance of water and the invisible threats that we face in this country. According to the Value of Water campaign, there are 68,873 drinking and wastewater systems in the United States. And also according to the Value of Water campaign, 64,240 gallons of water are used on average by American people in a year. Water infrastructure is very essential and also largely invisible. Few people realize what it takes to deliver drinking water every day and what it takes to clean wastewater so that it is safely reused and returned to the environment. The high quality of life we enjoy in America today would not be possible without water and the infrastructure that fuels it. According to the Value of Water campaign, in America, every 2 minutes, a water main breaks. The good news is the investment in the water infrastructure puts people to work and builds a stronger America.
Hi, my name is Janet Howard, and I'm going to talk about the finance section of the WIN Act. The Water Infrastructure for a Nation Act will be used to strengthen the water infrastructures, protect vital resources, and promote economic growth and competitiveness in the United States. The Water Infrastructure Finance and Innovation Act, also called WIFA program, will provide both public and private sectors with federal resources, enable them to complete critical water projects. The WIN Act allows for $20 million to be allocated for the WIFA program. This in turn expands the chances for larger loans to be obtained from private institutions. It is expected that for every dollar Congress loans to the WIFA program, there could be up to $60 in additional infrastructure loans provided. The WIN Act authorized $16 billion in federal funding for use by the U.S. Army Corps of Engineers as well. When an emergency to the public's health has been declared due to the presence of lead or other contaminants in drinking water received by a public water system, an additional $100 million is authorized for use by the Drinking Water State Revolving Fund. It's been speculated that under Donald Trump, he will push for new legislation on long-term water infrastructure needs, and putting forth a policy called America's Infrastructure First that supports federal investment in clean water among other domestic infrastructure needs. This proposed policy would use tax credits as private investments in public civil works projects, including water projects. One of the other ways that an entity can pay for a lead reduction project is through the establishment of a grant program. In order for an entity to qualify for a grant program, there are certain criteria that must be met. Some of the criteria that must be established are the source of lead in the water system is subject to human consumption, and the means by which the proposed lead reduction project would meaningfully reduce the concentration of lead in the water for human consumption by the applicable public water system. Priority for grants is given to entities that proposes to carry out a lead reduction project at a public water system or non-community water system that has exceeded the lead action level established by the administrator under Section 1412 of the WIN Act, anytime during the 3-year period preceding the date of the submission of the application of the eligible entity, and address the lead levels in water for human consumption at a school, daycare, or other facility that primarily services children or other vulnerable human subpopulation, as described in Section 1458 of the WIN Act. The discovery of lead in the water infrastructure falls under Title IV of the Affordable Care Act. This section is devoted to the prevention of chronic disease and improving public health. Lead in the water system is a public health crisis. In Section 4002 of Title IV of the ACA, it states, the purpose of this section is to establish a prevention and public health fund to be administered through the Department of Health and Human Services, Office of the Secretary, to provide for expanded and sustained national investment in prevention of public health programs to improve health and help restrain the rate of growth in private and public sector health care costs. This fund appropriates money ranging from $500 million for fiscal year 2010 to $2 billion for fiscal year 2015 and every fiscal year after that. These funds are to be used for programs authorized by the Public Health Service Act for prevention, wellness, and public health activities, including prevention, research, health screenings, and initiatives.
Thank you for taking the time to join us. Our hope is that we have left you feeling more informed about the Affordable Care Act, the WIN Act, and its direct effects on small cities such as Flint. Have a great night.